everyone, and welcome to yet another Tooth Talk with your dentist on thedentaire.com. I'm Dr. Rekha, and I'm streaming this talk live on both my YouTube channel and Facebook. To those of you all who subscribe to my YouTube channel, thank you so much. And for those of you who have not yet, please do subscribe to the channel to get your latest updates on your dental health. And to all my Facebook viewers, a warm welcome to you all again. And for those of you who tuned in for the very first time, I would like to tell you all that the Tooth Talk with Your Dentist is an initiative to increase oral and dental health awareness among people. To please click on the notification button so that you get notified the next time I go live. We have done a series of talk till now about various aspects on oral and dental health. And today what I would like to discuss with you all about is some very simple thing about your dental health, which is toothbrushing. So why do we have to brush our teeth? If we have noticed that there is no other animal species that actually uses a brush and a paste to clean their teeth, it is only we human beings have to use a brush and a paste to clean and brush our teeth. So what is the significance? What is the importance of tooth brushing? So before we go into that, what I would like to tell you is about one particular aspect on this dental health is something called as plaque. You might have heard or read it in so many places about a tooth plaque. Now, what exactly is a tooth plaque? Now, tooth plaque is a layer, it's a substance that is secreted by the oral bacteria. As you all know, our oral cavity, our mouth contains so many different types of bacteria. So some of these bacteria, what they do is they have a secretion, and when this secretion goes and accumulates on our tooth surfaces, it forms a very tenacious layer. Now, this layer is called a plaque. So you may ask, so what if there is a secretion that is happening because of a byproduct of a microorganism, and if that is getting deposited on our teeth, so what is the harm, what is the damage, what actually happens, and why should we remove this layer of plaque? Now, if it was just a layer that was accumulated on the tooth, it wouldn't have mattered. But this layer, which is called the plaque, which is invisible to our naked eye, attracts many other elements in the mouth, like your food debris, maybe minerals that are present in the saliva, and the bacteria itself. So what happens is this plaque creates a very safe home for these harmful bacteria to stay there and thrive there. So unless this plaque is not removed repeatedly, the bacteria that stays there causes damage both to your teeth and your gums. So what exactly happens? The plaque actually the formation of plaque rather is a very continuous process. It happens throughout the day, and the total plaque formation takes up to 12 hours to complete the formation. So it becomes very important for us to disrupt this plaque formation every now and then, so that the bacteria have to kind of, again start from the, start line. So they don't go till the finish line. So like I said before, why do we, as human beings, we have to use a toothbrush and a paste? Now, it is the mechanical cleaning action of the toothbrush and the microabrasives that are present in the toothpaste that actually help in disruption of this plaque, that is, removal of this plaque. Now, we have to do this at least twice a day, like I said, once in the morning, once in the night, within that gap, so that the plaque formation is not completed. Now, what happens also, which encourages the plaque formation and for it to remain in place to cause damage, is the fact that humans have shifted from eating raw and fibrous food to very fine and refined sugary food. So what exactly happens when you're taking raw and fibrous food? The fibrous food, whenever you chew on fibrous food, like say salads, crunchy vegetables and fruits. It is the mechanical cleansing action of this kind of food that disrupts this plaque repeatedly. So the plaque formation is not completed. The bacteria cannot sit there for long to cause damage to your gums and your teeth. Now, what happens in very fine, that is refined food and sugary food? This actually sticks to your teeth, and along with the plaque, it remains there and causes damage to your gums and your teeth. So, damage to your teeth is that there could be accumulation of decay causing bacteria, which increase the acidity in that particular region, cause dissolution of your tooth enamel, that is the hard part of your tooth, and then cause further damage to the tooth, leading to tooth bacteria. Now, what happens is when the plaque remains there along your gum line, what happens is these bacteria which remain there along your gum line cause damage to your gums, cause bleeding in your gums, and damage your gums. When this is left untreated, this damage goes further onto the bones, causes damage and infection in your bones, and can cause weakening or loose teeth. Now, what happens in some people? So in some of them, this plaque may remain as just an invisible layer that is actually not seen with our, we cannot see it with our naked eyes. Of course, there are some what we call as disclosing solutions or wafers that are available. Like when you chew on them or you rinse your mouth with it, it kind of stains this plaque and you can see the deposits, wherever they are, and clean accordingly. But in some people, what happens is, like I said, this plaque also attracts minerals that are present in the saliva, like your calcium. And so when this calcium goes and gets incorporated into this plaque layer, it hardens the plaque. So that is where when you notice, either you yourself could have it or any of your friends or any of your family members, you can see some yellowish to brownish or sometimes even a blackish deposit that is present on the tooth. Now when this plaque is hardened, we call it as tartar or calculus. So what happens is, this again is a porous kind of a material and it harbors more number of bacteria and it attracts more plaque accumulation on its surface. So the cycle repeats, it keeps going on. So what happens is, at this time, when you notice that there is a hard layer that is deposited on your tooth and that is not easily removable with your toothbrushing methods, it is really important that you visit your dentist. Your dentist or your dental hygienist will do a simple procedure called tooth scaling or a cleaning procedure and remove these hard deposits that are there on your teeth. So once these deposits are removed, the gums begin to heal and your tooth also heals. So it's really important that you follow the instructions of your dentist when they say that your toothbrushing and of course flossing is important. So why would your dentist or your dental hygienist say that flossing is equally important? Now, the bristles of your toothbrush are not so fine as to reach the area between the teeth. So the surfaces of the teeth get cleaned well with your toothbrushing. But what happens to the area between the two teeth, where plaque accumulation also happens? It is really important that this area, which we call as the interdental area, that is the area between two teeth, is also clean and is plaque free. So for this, you need to use interdental cleaning aids. Now, interdental cleaning aids come in various forms according to the requirement that is there for each patient. That is, either it can be a floss, it can be an interdental brush, oral irrigation devices, and so many other wooden picks and so many other interdental cleaning aids that are available. So you can use any one of these aids to clean the area between the teeth to remove the plaque in between the teeth. So a visit to your dentist regularly, say once in 4 months, I would recommend, so that your dentist recognizes any deposits that are happening or recognizes any decay that is happening between the teeth, and he helps you, figure that out with the help of radiographs, with a thorough examination, and he would recommend a scaling procedure, a cleaning procedure, and advise you on your correct brushing techniques and flossing or interdental cleaning techniques. I hope that talk was useful in understanding the basics of a tooth plaque, which is why the requirement for toothbrushing is there, first of all. So if you have any doubts or you would like to know anything more, please do leave your comments in the comment section below, and we will get back to you on that. And do visit our website www.thedentaire.com to get more information about your oral and dental health, and do subscribe to our YouTube channel, and do join our Facebook group to get your latest updates. So until next time that I come back with another dentist with another topic on your oral and dental health, keep smiling and be happy. Thank you.